I'm sorry, is there time?
Yeah, it used to be, tell me if I'm wrong, that in certain states where they didn't have all of the requirements that we have in New Jersey, it would be cheaper, a lot cheaper to buy health insurance.
Right.
Does that all level out now in all states?
That's right. As I said right at the very beginning, when we talked about New Jersey was ahead of the curve, New Jersey is so expensive because we've had a lot of these mandated benefits all along. And mandated benefits cost money. And just like the gentleman back there who said he had a $2,500 deductible, that's going to go to $2,000 next year, and that's going to raise his cost. And as you add these mandated benefits, it raises costs. So yes, it's going to level out. Like I said, Florida, they sell deductibles of $5,000 and $10,000. They're going to get slammed next year. Were you done?
Yeah.
Okay, Mike?
You may be getting to this, or maybe, again, rumor, what you think of the richer plans. You know, we have low deductibles, low co-pays, everything covered, the Cadillac plans,
Right.
that everyone pays for. Is there a penalty if you choose that rich plan?
Not now. In 2018, the quote Cadillac plans are going to be taxed heavily. There's going to be an excise tax on the premium paid in excess of certain limits. And again, that's one of those things that are in flux right now. I didn't cover it because it's so up in the air. I didn't want to confuse anybody and throw something out there that was going to go away.
So for some of my more affluent clients that just overpay for high level coverage, there really won't be it. Now, do they have to offer the exchange also, or to their employees? They have
Again, it depends on their size. If they're over 50 employees, yes, or 50 full-time equivalent employees, they have to offer it. Okay, but that is not scheduled to be considered until 2018, so you got some time.
Have you seen your clients work with that full-time employee equation?
Oh
figure
yeah,
out a way
it's a big deal.
to eliminate and/or reduce and/or consolidate staffing?
How can you? We've got one employer now where we're working with that is right on the cusp. There's like 47 employees, and they've got several part-timers. They're wrestling with what to do, and you've got to get the work done, so you've got to make it work somehow. But yes, to answer your question, there's a lot of consternation of what am I going to do? Should I reduce staff? But again, you still got to get the work done.
Yeah, I'm sorry.
Oh, okay.
They also did say that I believe they were going to allow you choose a 6-month snapshot of your year this year, especially for people that have peak seasons. They have a lot of seasonal employees that they can take a 6-month snapshot, I believe it was,
Right. So
and look at that payroll for those 6 months to do this equation against. So, I mean, there are people that have, they have peak season January, February, March. They're not going to want to pick that. They'll pick, something in the middle where they're at their normal their employment status.
we have one employer. In a second, then we've got one employer that sells on the turnpikes and the parkways, has little kiosks. So they have a 4-month window where their employment skyrockets. It goes from like 70 to 300. So they'll be okay because they can eliminate from their calculations the part-timers that work during that season. They can just cull them right out. Did I answer your question?
Yes, that was fine.
Okay, great. And then,
I'm just curious. Scott mentioned that term leveling out of costs. So
Right.
right now, uninsured lives are taxing our system because we pay for their health care regardless whether they have insurance or not. Is there any conversation around the notion that if we get uninsured lives insured, that ultimately the system will catch up with itself and costs will level out, as Scott says? No.
well, you brought up an interesting point. Whenever the government spoke about the problem, they said there were 35 million uninsured people in the country. They didn't say uncovered, because as you know, everybody has coverage. Anybody can go into a county hospital or any hospital that accepts federal funding and be covered. you'll get good treatment. So to answer your question, I don't know. I wish I had a crystal ball and could figure that out, because as I see it personally, no. It's just gonna add. It's just gonna be a boondoggle. Just the administrative costs are going to be phenomenal, and that's all going to be passed along to the rates.
Just the administrative costs, the rest of it would be $45-$30.
There goes your savings and insuring uninsured lives.
This is just a tip of the iceberg.
Exactly.
Follow
Okay, more complicated situations.
You can move it along a little bit.
Okay, I'm trying.
The Q&As are going to be good.
Small employees with less than 50 full-time, but a lot of what we covered this, the 50 full-time equivalent. Companies that employ seasonal employees, as Liz addressed, it's going to be, they're going to be taken care of. They're not going to be subject to a problem. Special industries, educational institutions, theatrical companies that only work a little bit, they're not going to be subject to it. Are the savings worth the tax penalties? That's your question, Tom. Employer reporting. Starting in 2014, and again, that's why you have to keep records during 2013. This will be required in the first returns in 2015. You're going to be obliged, switch to the next one. There's large employers. You're going to have to report the employer identifying information, whether the employer offers health coverage to full-time employees, the number of full-time employees for each month, length of any waiting period, monthly premium for lowest cost option in each enrollment category, employer's share of cost of benefits, names and contact info for employees, and months covered by the health insurance plan. Every employer is going to have to provide, every 50 plus employer is going to have to supply all of this information every year by month. By month. Tom? Okay, be on the lookout. We're almost done. Automatic enrollment rules. If you have more than 200 employees, every employee will be enrolled in your plan unless they opt out. Okay, Tom? The plan is constantly evolving. As Liz touched on before, contraceptive changes for religious group. The W-2 reporting they're coming out with more every day. Effective dates are changing every day. Every day I get a bulletin that something's been postponed or something's been eliminated. Class Act suspended. The government, in their infinite wisdom, said they're going to tackle the problem of long-term care. So a part of the act was the Class Act that provided voluntary long-term care insurance, that you had to have a 5-year wait before you had benefits. It was such a mess, they just threw it out. Speaking of throwing it out, and I hate to admit this, but I was there when this happened. When Medicare was introduced during the Johnson administration, it was such a mess and so bad that they virtually threw it out, rewrote it, and introduced it the next year. Let's hope that happens. Take stock, review, and prepare. Again, 2013 is a very important year for employers. They're going to have to assess their situation, excuse me, and look at it and decide what you're going to do. Because by the fourth quarter of 2013, you're going to have a picture of where you are, what you have to do, and how you're going to have to do it. Tom? Basically, it's simple. If you're a company with less than 50 employees, your decision will include whether to keep your current coverage or buy a plan from the marketplace. If you qualify for a tax credit in 2014, you can only get it if you purchase coverage in the exchange. Whether to continue buying it all. That's what we hear from a lot of our small employers. Well, I'm just going to scrap my plan. Well, that's great. But what's going to happen to your hiring practices when somebody comes to you and says, well, what benefits do you offer? You can't very well say, wait on, go to the exchange. We're going to give you $500 extra in your salary. Well, that doesn't work. employee morale. Owners and senior employees would also lose coverage. You can't have a plan anymore that's just going to cover top employees. Individual market will more likely be more costly than the exchanges. I don't know that. One final point, we talked about the penalties, and people are saying, well, I'm going to pay the penalty and let it go. Well, keep in mind, the penalties are not tax deductible. The premium you pay will be tax deductible. So that kind of narrows the field a bit. Tom? Okay. I'm out of breath. Anybody have any questions?
So for the individual that has to go to the exchange for an individual and they elect still not to buy it, their obligation out of pocket caps at $95.
For 2014, or it's $95 or 1% of your earnings.
Is the other portion of that then when they go to the hospital looking for now this free coverage, that they are declined, turned away? Or?
Still, that's still. That was a question I had yesterday from a client. Now, if I do it, what about charity care? Again, if the hospital accepts federal funding in any form, they must treat the person.
So it's federal funding. If it's a private hospital.
Private hospital, they have to get them stabilized, then they can ship them off to Bergen Regional or whatever.
In regard to the wellness program that we touched upon, that no more than 20% of the cost of coverage is actually over 30%. Can you just go over some of the specifics of that? I'm not aware of how it works.
Well, so is everybody. Again, that's one of these concepts they threw out there and didn't provide a whole lot of information on. Again, if it offers weight loss, smoking cessation, cardiac care, and is aimed towards improving health, it will qualify in a very broad terms.
Okay, but take that one step further, because that's where I'm getting lost. Is it would decrease their health cost by 30%?
Supposedly, you're going to be able to get a credit from the government. You're still going to pay the premium, but you can apply for a credit for that cost if you have a qualified health wellness program. And it isn't just something you're going to be able to say, well, we provide an exercise room. You're going to have to hire a company to come in, and we've got one in Scirocco that will come in and actually sit with employees, screen them for cholesterol, for blood pressure, for weight loss, smoking, and help them on a program. That's a program that will qualify. You just can't have an in-house, loosey-goosey program and apply for a credit.
But does it cost the participant half of the cost of the program? Or is it a tax credit?
It's going to be a credit against, the tax credit against the premium as it stands now. In other words, if you pay $1 million in premium for your employees, not their spouses or family, of the employee cost, again, as it's designed now. So say you have 100 employees.
Does Scirocco get the credit?
Yes.
The tax credit? Or
Yes.
The employee?
The firm gets the credit. It's the only way they could do it right now.
Someone who is unemployed now, are you saying that their search for a private coverage now, that with this plan it will not be any cheaper for them?
No. Okay. Again, do me a favor and do yourself a favor. Go to these exchanges, go to the carriers right now as if you were applying for an individual health plan. You'll be astonished.
Oh, I know that. I was wondering whether, the hope was that this plan would make it cheaper, less expensive for people who weren't covered for one reason or another.
Again, if I had a crystal ball, I'd be able to tell you. I can't imagine how it could be, but stranger things have happened.
Will vendors under the bronze, silver, platinum,
Gold, platinum, red.
metal plans, can a vendor decide that it will bill back for bronze and whatever the next one up and not build back any costs, like you were giving dental MRI 1,700, but the bronze plan only gives you 500. Can the vendor decide that it will build back that difference under bronze plans, but not build back the difference for the platinum plan?
The same rules are going to apply. If it's an in-network plan and the provider is in-network, no, they can't balance bill.
They can't.
Cannot balance bill.
Your out-of-network doctors don't have any contractual obligation to not balance bill, so that's why things can be exorbitant when you go to an out-of-network provider. The plans right now that we're looking at don't necessarily comply to the metal requirements. So we haven't seen those plans yet. We just know about the co-insurance and the deductibles. We don't know how they're going to handle labs, et cetera, et cetera. We don't know what those cost sharing situations are going to be. We do know that there's new ceilings on the maximum out of pockets and the deductibles and the co-insurance, but we have no idea what these plans look like yet. And with the delay in the notice, we don't know.
No, we don't know. Incidentally, I didn't give out the slide presentation, but if you want one, please give me a card and we'll send you a PDF of it. Any other questions?
Still hung up on this 9.5.
Okay. I know. Hey, don't feel bad. It's a very slippery concept.
Let's say I earn $50,000 a year.
Right.
And for the family, I elect family coverage. And in doing that, I have to contribute $500 a month.
Right.
That's going to be over the 9.5%.
It's only it's only the plan you select for your rate. Anything,
For the
any
single-
incremental cost
that's
for
a
the
single-
single
that's a
cost.
single.
Any incremental is your responsibility.
Okay. That's clarified.
Let me tell you, there's a lot in here that I sit and scratch my head, try to figure it out, and I work with it every day. Anything else?
Could we have done this better?
The simple answer is yes. There are a lot better ways to do it, a lot simpler ways to do it, without 2,700 pages of things like the Class Act that got thrown out anyway. And you read some of these things, and you can't even read it. You just can't wrap your mind around some of the things that they put out there, and it's all subject to interpretation. How do we do on time? Thank you all for your attention. And again, if you want a copy, if you'd like the slides, give me a card and I'll make sure you get a PDF.